Radiation therapy in cancer treatment, mechanisms and clinical applications. Radiation therapy uses high-energy beams to destroy cancer cells by damaging their DNA. This fundamental oncology treatment can be delivered externally or internally and is often combined with surgery and chemotherapy for optimal outcomes. What is radiation therapy? Radiation therapy represents one of the cornerstone treatment modalities in modern oncology, utilized in approximately half of all cancer patients at some point during their disease course. This therapeutic approach harnesses the power of ionizing radiation, energetic particles or electromagnetic waves, to deliberately damage the genetic material within malignant cells. The fundamental principle underlying radiation therapy is that cancer cells, which typically divide more rapidly than healthy cells, are generally more susceptible to radiation-induced damage. When cancer cells sustain sufficient damage to their DNA, they lose their capacity to reproduce and eventually undergo cell death, thereby reducing tumor burden and potentially achieving disease remission. How radiation damages cancer cells. The mechanism by which radiation exerts its therapeutic effects involves direct and indirect pathways of cellular injury. When high-energy radiation penetrates tissue, it can directly strike and break the DNA double helix within cancer cell nuclei. This direct damage is particularly effective at targeting the genetic blueprint that governs cell division and survival. Beyond direct effects, radiation also generates reactive oxygen species, highly unstable molecules with unpaired electrons, that indirectly damage cellular structures and genetic material. These reactive molecules can accumulate to dangerous levels within cancer cells, leading to oxidative stress and triggering programmed cell death pathways. The combination of direct DNA damage and indirect oxidative injury makes radiation an effective tool for eliminating malignant populations while sparing sufficient numbers of healthy cells to maintain normal organ function. External beam radiation therapy. External beam radiation therapy, EBRT, constitutes the most commonly employed form of radiation treatment in clinical practice. This approach involves directing a focused beam of radiation from outside the body toward the tumor site, using specialized equipment called linear accelerators or LINACs. These machines generate high-energy photons or electrons that penetrate the skin and underlying tissues to reach cancerous lesions deep within the body. The radiation beam is carefully shaped and directed using advanced imaging and computerized treatment planning systems to maximize tumor coverage while minimizing exposure to surrounding healthy structures. Patients typically receive treatment in multiple sessions, called fractionation, delivered over several weeks, which allows normal tissues to recover between treatments while cancer cells accumulate lethal damage. Internal radiation therapy. Internal radiation therapy, also known as brachytherapy, employs a fundamentally different delivery strategy by placing radioactive sources directly within or adjacent to tumors. This approach can involve implanting radioactive seeds, ribbons, or tubes containing isotopes such as iridium-192 or cesium-137 into the tumor mass or nearby tissues. By delivering radiation from within the body, brachytherapy achieves extremely high radiation doses to the malignant tissue while dramatically reducing exposure to distant normal structures. The proximity of the radiation source to cancer cells makes this technique particularly valuable for treating localized tumors such as cervical, prostate, and head and neck cancers. Treatment duration varies depending on the specific technique employed, ranging from temporary placement of sources for hours to permanent implantation of radioactive seeds that decay over time. Specialized radiation techniques. Key points: intensity-modulated radiation therapy, IMRT, uses variable radiation beam intensities to conform doses precisely to tumor geometry, reducing toxicity to healthy tissues. Image-guided radiation therapy, IGRT, incorporates frequent imaging during treatment to verify tumor position and adjust beams in real time for improved accuracy. Stereotactic radiosurgery, SRS, delivers highly focused radiation to small intracranial lesions using hundreds of small beams that converge on the target. Volumetric modulated arc therapy, VMAT, rotates the radiation gantry around the patient while simultaneously modulating beam intensity for rapid, conformal dose delivery. Treatment planning and simulation. Before commencing radiation therapy, patients undergo comprehensive treatment planning to optimize therapeutic outcomes and minimize complications. This process begins with simulation, during which high-resolution imaging, typically computed tomography scans and sometimes magnetic resonance imaging, defines the precise location and extent of the tumor and identifies nearby critical structures that must be protected. Radiation oncologists carefully contour the tumor and organs at risk, establishing target volumes and dose constraints. Medical physicists then use sophisticated computer algorithms to design individualized treatment plans that deliver prescribed radiation doses to malignant tissue while respecting tolerance limits of adjacent normal structures. The plan is verified through quality assurance procedures, including dose calculations and phantom testing, to ensure accurate delivery of the intended radiation distribution. This meticulous planning phase, while time-consuming, is essential for maximizing therapeutic benefit while maintaining patient safety. Acute and late side effects. Radiation therapy, while effective against cancer, inevitably affects some normal tissues within the treatment area, potentially causing both acute and delayed side effects. Acute effects develop during or shortly after treatment completion and typically resolve within weeks to months. These may include skin erythema resembling sunburn, fatigue, nausea, and temporary loss of hair in the treatment field. Late or chronic effects can emerge months to years after therapy and potentially persist indefinitely. These include fibrosis of tissues with decreased elasticity, secondary cancers arising from radiation-exposed normal cells, sexual dysfunction, and organ-specific complications such as lung fibrosis, cardiac disease, or cognitive changes if the brain was irradiated. The severity of side effects depends on the radiation dose delivered, the volume of normal tissue exposed, the specific tissues affected, and individual patient factors including age and comorbid conditions. Careful dose optimization and protective techniques help minimize these risks while maintaining curative effectiveness. Combination with other cancer treatments. Modern cancer management frequently employs radiation therapy in integrated treatment strategies combining multiple modalities for enhanced outcomes. Surgery often precedes or follows radiation therapy, with radiotherapy eliminating microscopic disease that may remain at surgical margins or in regional lymph nodes. Chemotherapy can be administered concurrently with radiation therapy, a strategy called chemoradiation, which may enhance radiation efficacy through improved oxygenation of tumor cells or direct radiosensitizing effects. Biologic therapies and immunotherapies are increasingly combined with radiation, exploiting potential synergistic interactions wherein radiation-induced tumor cell death may amplify immune recognition and anti-tumor immune responses. The sequencing and integration of these modalities requires careful coordination among surgical, medical, and radiation oncologists to optimize treatment timing and patient tolerance while avoiding excessive overlapping toxicity. Patient preparation and expectations. Patients embarking on radiation therapy benefit from comprehensive preparation and realistic expectations regarding the treatment course. Most external beam radiotherapy sessions take 15 to 30 minutes, though only a fraction represents actual radiation delivery, with the remainder consumed by positioning and verification procedures. Treatments occur on an outpatient basis, typically 5 days weekly for 5 to 8 weeks, depending on tumor type and stage. Patients should understand that radioactive therapy is painless. Radiation cannot be felt or sensed during delivery, but positioning devices may feel uncomfortable. Maintaining consistent nutrition, hydration, and skin care throughout treatment is important for tolerating therapy and maintaining function. Support from family, friends, nutritionists, and mental health professionals enhances coping and treatment adherence. Setting realistic goals, understanding the expected timeline for response, and maintaining open communication with the oncology team helps patients navigate what can be a psychologically and physically demanding course of care. Future directions in radiation oncology. Radiation oncology continues to advance through technological innovation and biologic insights that promise enhanced precision and efficacy. Particle therapy, particularly proton and carbon ion radiotherapy, offers superior dose distributions that spare more normal tissue than photon-based approaches, with growing availability of these resources internationally. Adaptive radiotherapy strategies continuously replan treatment based on anatomic changes occurring during therapy, further optimizing outcomes. Integration of artificial intelligence and machine learning is improving target delineation, treatment planning optimization, and prediction of treatment response and toxicity. Combination approaches with novel systemic therapies, checkpoint immunotherapy, and targeted biologic agents are under investigation to enhance local and distant tumor control. Improved understanding of radiobiologic mechanisms is facilitating identification of biomarkers predicting individual radiosensitivity and treatment response. These advances hold promise for delivering increasingly personalized, precise radiotherapy that maximizes cure rates while minimizing complications. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.